let's go to part 2.
I was pretty satisfied, so I go back to watch. I just have to finish so I get someone close. I get someone close around here, so I got like an hour off. So, music appreciation. I go that fast. We'll start with something casual and dim the lights, and then just take 20 minutes up each day. How's it? Maybe that's good. And then he like getting over some of those things. He said 80% is attendance and 20% really little progress.
Yeah. So do you need that for it instead of using art or teaching? I took art. Unless you want to save it.
Okay, everybody. Now we'll talk about a few other things. First, we'll talk about the disorders of red blood cells, erythrocyte disorders. One type of disorder is one type of disorder of red blood cell is anemia. So we'll talk about anemia, different types of anemia and causes. Then we'll talk about the white blood cells. There are 5 different types of white blood cells. How many types? 5 different types of white blood cells are present in the blood. We'll talk about that. Then we'll talk about platelets or thrombocytes, another type of blood cells. Then we'll talk about coagulation, which is blood clot formation, right? And blood types or group. You know, there are different blood groups, A, B, O. We'll talk about that, okay? Blood type or group. First, I clicked several times, so it's coming one after another.
I'm on my blackboard and it says that this content may be out of date. It won't load.
You don't load?
No.
Okay, so I will repost it, okay? Yeah, something is wrong. I know that's okay. Okay, looks like we are good. Okay, so anemia. Anemia, I believe all of you have heard, right? This clinical condition. Anemia is decreased ability to transport oxygen by the blood. So, if the blood's ability to transport oxygen goes down, that is termed as anemia. Now, who transports oxygen? You tell me. Hemoglobin, right? We know that. Iron. Oxygen binds with iron, right? We talked about that already. So, red blood cells. Inside the red blood cell, you have hemoglobin that binds with oxygen and transport oxygen, right? So, if the number of red blood cell decreases, then oxygen transport will be less. Make sense? Make sense? Because we know red blood cells contain hemoglobin. But if the number of red blood cell count is normal, but amount of hemoglobin inside those red blood cells is less, that will also cause anemia. Make sense? Because, so anemia could be due to decreased number of red blood cells, like this is normal red blood cell count. So this is a normal count of red blood cell. Inside the red blood cell you have what? Hemoglobin. Very good. So this is hemoglobin, normal person. Okay. And this is another person's blood, same amount of blood. This one has less red blood cells. Make sense? So the count is low here. Red blood cell. So this is normal count. This is lower number of red blood cell. So who is anemic? Lower count of red blood cell. This is anemic, right? Because the oxygen carrying capacity will be less in this case. Clear? So that is one cause of anemia. Now let's see another thing. This is normal person. This is anemic. The number of red blood cell count is same. The number is same in these two. But see here, if this person has less hemoglobin inside the red blood cell, like a small amount of hemoglobin in each cell, although the number of red blood cell is same, right, in these two, but which one will carry less oxygen? This one. Make sense? Because of less amount of hemoglobin, although the count is same. Is it clear? So it could be due to decreased number of red blood cell or due to decreased amount of hemoglobin inside the red blood cell, right? Make sense? So if you test someone's blood and see the count is normal, red blood cell count, can you be sure that he doesn't have anemia? No, because you have to also measure the amount of hemoglobin, right? Amount of hemoglobin. That is another type of anemia that occurs due to abnormal hemoglobin. Like for example, sickle-cell anemia, one type of abnormal hemoglobin containing anemia. Hemoglobin is there, the red blood cell is there, but the hemoglobin is non-functional. This hemoglobin cannot bind with oxygen. So this is also anemia. Make sense? So now you know that three things can cause anemia. Number one, decreased count of red blood cell, right? Number two, decreased amount of hemoglobin. And number three, abnormal hemoglobin. Make sense? Abnormal hemoglobin will not be able to bind with oxygen. So oxygen carrying capacity will be low. Okay. Now, the signs and symptoms of anemia. Anemic person gets tired very quickly, fatigue, paleness of the skin and mucous membrane, or nail beds, shortness of breath, and chills. So these are some common signs of anemia. Now we'll see the causes. I have already explained. Insufficient red blood cells, less number of red blood cells, right? Insufficient red blood cells or erythrocytes. Now what can cause decreased count of red blood cell? Number one, hemorrhagic anemia. Hemorrhage, bleeding. If someone gets accident, okay, bleeding occurs, blood loss occurs, then the count of red blood cell in the blood will go down. So that is hemorrhagic anemia. Major surgeries, big surgeries, right? Lot of water, blood loss has occurred. So the count of red blood cell will go down. Make sense? Those are acute loss of blood, sudden loss of plenty of blood. Make sense? Chronic loss of blood, that means small amount but for long time. like many days, many months, okay? That is chronic. Can you give me an example of chronic blood loss? Ulcer, very good, right? Gastric ulcer. If bleeding occurs, right, small amount of blood is leaking, long time, right? So that can cause anemia, hemorrhagic anemia or bleeding related anemia. You know, worm, hookworm, tapeworm, different types of worm that, you know, sometimes lives in the intestine. They suck the blood, right? So that is also chronic loss of blood, right? They stay for years if you don't get the treatment. So those are chronic loss. Hemolytic. Lysis means what? Breakdown. So if the red blood cell breakdown, excessive breakdown, normal breakdown is normal, right? We know that after 90 to 120 days red blood cells will die. But if excessive breakdown of red blood cell occurs, that will decrease the number of red blood cells. Make sense? Very simple. Aplastic anemia. If the bone marrow is destroyed or depression of bone marrow occurs, that means the bone marrow function is less, then the red blood cell count will be low because we know that blood cells come from the bone marrow, right? Bone marrow is the primary site for the production of blood cells. So if bone marrow is destroyed or depressed, that will cause decreased number of red blood cells. Is it clear? What can cause depression of bone marrow or destruction of bone marrow? Some chemicals, for example, anti-cancer drugs, chemotherapy, okay, can cause destruction of bone marrow or depression of bone marrow, okay. Excessive radiation. That's why some people, don't want to pass through the airport, security. So frequent flyers, right? They every time they pass through, so they are concerned that excessive radiation can cause depression of the bone marrow. Make sense? So those are three types of insufficient erythrocyte mediated anemia. Low hemoglobin content, as I have explained to you at the very beginning, that even the number is same, but amount of hemoglobin is less. That's the low hemoglobin content anemia. Low hemoglobin content anemia includes iron deficiency anemia and pernicious anemia. Okay. Now, iron deficiency anemia is due to lack of iron insufficiency. We know that iron is a main component of heme part of hemoglobin. So that is iron deficiency anemia. Pernicious anemia occurs due to lack of absorption of vitamin B12 in the intestine. You know that you take food and vitamins, right? And if food also contains vitamins, so if the vitamin B12 is not absorbed, taken into the blood from the intestine, okay, then the person will suffer from lack of vitamin B12. Make sense? There is a factor released in the intestine that is called intrinsic factor. Let me write it down. Intrinsic factor. That binds with vitamin B12 and helps in absorption of vitamin B12. Okay? If lack of intrinsic factor is in the intestine, that will cause lack of absorption of vitamin B12. So it is here. Okay. Abnormal hemoglobin. Abnormal hemoglobin could be due to defective gene. So, abnormal hemoglobin content anemia mostly occurs due to defective genes, and hereditary come from parents. Okay. One type of abnormal hemoglobin content anemia is called thalassemia. Thalassemia. SE. Thalassemia occurs due to defect in alpha or beta chains. You remember globin part of heme has 2 alpha, 2 beta, remember that? So if those amino acid chains are defective, that causes abnormal hemoglobin. So thalassemia could be 2 types, alpha and beta. If defect or fault is in alpha chain, that is alpha globin thalassemia. If it is in beta chain, beta globin thalassemia. So it could be either, okay? A defect in alpha chain or beta chain. So defective globin chain. That hemoglobin is not fully functional. Another type of defective hemoglobin is sickle cell anemia. In sickle cell anemia, what happens, the red blood cells are not round anymore, they look like sickle or crescent moon. You know crescent moon? Crescent shaped like this, and hemoglobin is here. So the red blood cells, the shape of the red blood cells changes, and also hemoglobin becomes elongated like this, okay, inside. And hard hemoglobin, this hemoglobin is not capable to bind with oxygen. Those are useless hemoglobin. Sometimes these red blood cells, these are hard form of hemoglobin, and these red blood cells accumulate inside the capillaries and block the capillaries. That causes severe pain. The first patient complains a lot of pain, sometimes pain in the chest or other part of the body, because those abnormal cells, red blood cells, can block the blood vessels, narrow blood vessels. Make sense? So, and these cells are not capable to bind with oxygen. Make sense? Because these are abnormal hemoglobin. And there is no treatment, just symptomatic treatment. What's the problem? You will solve the problem. Okay? When pain, use the painkiller or dilate the blood vessel, whatever. So, make sense? Okay. Hereditary. So this sickle cell anemia is found more in African origin people, black people. They suffer from sickle cell anemia more. And so these are 2 abnormal hemoglobin content anemia. Sickle cell anemia occurs due to the abnormal beta chain, and what happens, amino acid chains, amino acids are like this. At one place, the amino acid glutamate is replaced by valine. You see, this is normal. This is the amino acid chain. These are amino acids, globin, and only one location change occurs. This is replaced by valine, and that causes this, change of hemoglobin. So this is a hereditary disorder or problem. Polycythemia. Polycythemia is kind of opposite of anemia. If the count of red blood cell goes up, that is called polycythemia. Increased number of red blood cells, much higher than normal. And that can sometimes cause increased viscosity. You remember viscosity, one property of blood is viscosity, that means thickness, right? And stickiness, I say. So if the number of red blood cell is very high, then blood will become more thick, right? So that can cause problem, increased viscosity. Now, polycythemia could be two types. One is physiological polycythemia. That means that is normal. That's not an abnormal condition. Physiological, okay? Physiological polycythemia is normal. It will happen to everybody. Example, if you go on the to the top of the mountain where oxygen pressure is low, your red blood cell count will go up. You remember I talked about that in last class. Hypoxia, lack of oxygen will increase the production of red blood cell. Make sense? So that will happen to everybody, right? Whoever goes there. And when we come back, it will get back to normal. The count will get back to normal. So that is physiological. Now, pathological or clinical polycythemia occurs due to cancer in the bone marrow. That is called secondary polycythemia. Tumor or cancer in the bone marrow that can increase the production of red blood cell. This is a clinical polycythemia. Okay? Sorry. So polycythemia vera is the clinical, pathological, due to tumor or cancer in the bone marrow. Okay? And physiological polycythemia that I said, which is also called secondary polycythemia. Same thing. Physiological or secondary. That will happen due to hypoxia or lack of oxygen in the body. So this one is not abnormal. This is normal response of the body. Secondary or physiological polycythemia. Polycythemia vera is a clinical or pathological due to cancer in the bone marrow. So those are two types of polycythemia. Sometimes, athletes, they artificially creates polycythemia. They inject red blood cell, their own red blood cell, they take out, and before the performance, they inject into the body. It is not acceptable, but if you do without knowledge, why they do that? More red blood cell means more oxygen carrying capacity. Make sense? So if you inject more red blood cell into your body, the oxygen carrying capacity will be more, right? So the ability to perform will be better. So you will get more strength. This is not acceptable, but that is called blood doping. Probably you have heard it. Yeah, so doping is another. So those are different types of polycythemia. Now we'll talk about the white blood cells. We are done with the red blood cells. Now we'll talk about another type of blood cells, white blood cells or leukocytes. How many different types? 5 different types of white blood cells. White blood cells have some special properties. So what are those? Margination, diaphoresis, amoeboid movement, positive chemotaxis, and phagocytosis. So let me explain what are those properties of white blood cells. So this is a blood vessel. Okay, for example, this is a vein. We have tiny holes in the wall. And these are the white blood cells. These are white blood cells or leukocytes. Okay. Now, outside of the blood vessel, in the tissue, if any injury occurs, like inflammation, due to microorganisms, like bacterial infection has caused inflammation here, okay, outside of the blood vessel. What will happen, instead of passing through the blood vessels, these white blood cells will get attached to the wall, inner surface of the wall of the blood vessel. They will line up like this. That is called margination. So they can detect that something has happened outside. So they will get attached to the wall. That is called what? Margination. Make sense? Then they will try to get out from the blood vessel, squeeze through the pores in the wall of the blood vessel, and that process is called diapedesis. Okay, diapedesis. They will get out through the pores, squeeze out through the pore. That is called diapedesis. And after they come out, they will start to move towards the site of inflammation. How? They will move like amoeba. Have you heard amoeba? Single cell microorganism. Amoeba produces step like structures from the body and move. So these white blood cells will move like amoeba. That is called amoeboid motion. Amoeboid motion. Makes sense? Like amoeba, they will move towards the site of inflammation. And then when they will arrive here, they will do phagocytosis. That means engulf the microorganisms, okay, or dead tissue or cells will be engulfed by the white blood cells, okay. So that is phagocytosis. You already know what is phagocytosis, okay, eating or engulfing, okay, make sense? So now another thing, why the white blood cells after they come out will move towards the site of inflammation? Because when inflammation occurs, some chemicals are released there, right, at the site of inflammation. So that chemicals will attract the white blood cells towards the site of inflammation. Make sense? Because of that chemical change in that area will attract the white blood cells. And that is called chemotaxis. Positive means towards and negative means what? Away, repelling. Make sense? So since it is attracting towards, that is called positive chemotaxis. Okay, so those are the important properties of white blood cells. So if I ask you in the exam, you will write and explain those. Okay. There are 5 different types of white blood cells. We group them into 2, granulocytes and agranulocytes. Okay? 3 of them belong to granulocytes and 2 of them belong to agranulocytes. Which ones have granules? Granulocytes or agranulocytes? Granulocytes. That's why they are called granulocytes, right? Cyte means cell, have granules. So 3 are granulocytes. That means those 3 have granules in the cytoplasm. Is it clear? And 2 don't have granules in the cytoplasm. That's why they are agranulocytes, absence of granules. What are the granulocytes? Neutrophils, eosinophils, basophils. Another way to know or identify, they end with what? Phils. Okay? Granulocytes end with fields. Agranulocytes end with cytes. Lymphocytes and monocytes. Is it clear? Okay. Now, how you will identify them? Neutrophil. If you see the nucleus of a neutrophil, usually we see 3 to 6 lobes. This is the nucleus, it has 3 lobes, this one. So we see multiple lobes in the nucleus, that's neutrophil. Cytoplasm has granules, but these granules take both acidic and basic stains, so kind of neutral. That's why the color is pale. Cytoplasm is pale colored because the granules in the cytoplasm take both acidic and basic colors or stains, so they cancel each other. Make sense? If someone takes both acidic and basic, they will cancel each other. So it's this kind of neutral state. So that is neutrophil. Most of the white blood cells are neutrophil. About 65% of count of white blood cells neutrophil. The range is 50 to 70. You can say 50 to 70% of white blood cells are neutrophils. So if you count 100 white blood cells, you would expect that 50 to 70 will be what? Neutrophils. Make sense? Then, another type of white blood cells, basophils. Nucleus is bilobed like this, 2 lobes. And the granules are blue or purple, blue colored granules attached also to the nucleus. So this is basophil, takes basic stain, bluish. Another type of granulocytes are called eosinophil. Eosinophil is also bilobed, that means 2 lobes, like this. But the granules take acidic stain, that means red or orange color. So these granules will be stained by red or brown, red or orange. So eosinophil, eosin is the stain, acidic stain. Okay. So these are 3 types of granulocytes. Is it clear? Okay. Now we'll talk about agranulocytes, lymphocytes. Lymphocytes have large round nucleus. So this is the nucleus. So almost whole cell is filled by the nucleus. Almost whole cell is filled by or occupied by the nucleus. Makes sense? Large round nucleus. And so this is lymphocyte. Lymphocyte is second highest in number in the blood. About 25% to 45% cells are lymphocytes. So if you count 100 white blood cells, you will expect that 25 to 45 will be lymphocytes. Make sense? So highest is the neutrophils, second highest lymphocytes. Others are very few. Basophil, eosinophil, and another one is the monocyte. Large cell compared to all other white blood cells, monocytes are much bigger in size, and the nucleus is kidney shaped or bean shaped nucleus. In some places you will say horseshoe shaped, but how many of you have seen horseshoe? It's like, horseshoe shaped nucleus. So that is monocyte. So these two don't have granules in the cytoplasm. That's why these are agranulocytes. All white blood cells have phagocytic property. Some are more than others. But phagocytosis, you remember I said one important property is phagocytosis, right? Engulfing the antigens. So providing immunity. Now, basophil is especially important. Why? Because basophils produce and release two important chemicals, histamine and heparin. Histamine helps in inflammation and heparin is anticoagulant. Anti what? Anticoagulant. That means what? Prevent clot, right? Prevents clot. Keep the blood liquid, which is very important. So that's why basophil is especially important for releasing these two chemicals. Eosinophil is sensitive to allergic reaction. Allergic reactions. Okay. So the number of eosinophil goes up in allergic reaction. If you count the eosinophil, you will see the number has increased. So those are 5 different types of white blood cells. Their morphology, that means how you will identify them, right? And the count. Here, you see neutrophil, granules are not deeply colored like pill. This is the nucleus, multi-lobed nucleus. This is eosinophil. Now look carefully. This is when you'll see under the microscope in the lab. This is important. Nucleus always is kind of bluish or purple color. So this is the nucleus. How many lobes? 2. You can see here. Granules are orange or red. These are the granules. Basophil. The nucleus is also here bilobed. It's not very clear here, but you have to look very carefully. Granules are purple or bluish. Basophil. So remember BB. Basophil, bluish granules. Okay. This is a lymphocyte. This is the nucleus, occupies almost the whole cell. This is a monocyte, very big cell, kidney-shaped nucleus. Okay? Monocytes, just know that this is important. Monocytes can get out from the blood and enter into the tissue and become macrophages. Okay. So, monocytes can be converted to macrophages in the tissue. Here, you see, those monocytes get out from the blood vessel, enter into the tissue, they will be converted to macrophages. Okay, so those are different types of white blood cells. Now, abnormal conditions. Leukopoiesis is the production of white blood cells in the bone marrow. Now, a term that is called leukocytosis, and another is called leukemia. What is the difference between these two? Leukocytosis is increased number of white blood cell or increased production of white blood cell due to infection. For example, you got infection, the white blood cell count will go up. That is a normal response. Make sense? That is what? Normal response. And that's how the doctors detect if you have an internal infection, because you cannot see from outside, right? So we'll ask you to count your white blood cell. And if they see that the white blood cell count is slightly higher than normal, okay, has increased, they will think that you might have some internal infection. Is it clear? So that is called leukocytosis. Normal count of leukocyte or white blood cell is 4,000 to 11,000 per microliter or cubic milliliter of blood. Okay? So that is the normal count. In case of red blood cell, million, remember 5 to 6 million. So this is 1,000, much less. Now if the count goes up above 11 due to infection, we say leukocytosis. Okay? Leukemia is also known as blood cancer, commonly known as blood cancer. The number of white blood cell increases heavily. Huge number of, white blood cells are present in the blood due to cancer in the bone marrow. Stem cells that produce the white blood cells will become cancerous, and that will cause leukemia. Okay? So the number of white blood cell increases abnormally high due to cancer in the stem cells of the bone marrow. Now, in last class, I mentioned that all blood cells come from one type of stem cells, that is hemocytoblast. You might remember I did draw hemocytoblast and white blood cell, red blood cell, platelets, right? All of them come from that pluripotent stem cell. Okay? So you see here, hemocytoblast is the source stem cell. Then hemocytoblast can produce myeloid stem cells or lymphoid stem cells. These are also stem cells. Okay? But some differentiation has occurred here. What is the differentiation? Once lymphoid stem cells are produced, the lymphoid stem cells only will produce lymphocytes. Make sense? So that is the differentiation. Lymphoid stem cells will not produce other cells. That is called differentiation. Myeloid stem cells will produce all other blood cells except lymphocytes. All other blood cells come from myeloid stem cells. Make sense? That means red blood cell, platelets, and 4 other white blood cells except leukocytes. So you see here, eosinophil, basophil, neutrophil, monocytes. These 4 different types of white blood cells are coming from myeloid. Okay? And only lymphocytes are coming from lymphoid stem cells. And that's why the leukemia could be 2 types. If lymphoid stem cell become cancerous, then the number of lymphocytes will be very high in the blood. If myeloid stem cells get cancerous, then other white blood cells number will become abnormally high. Make sense? So depending on which one is abnormal. Okay. So two types of leukemia, myelocytic and lymphocytic leukemia. Problems of leukemia. The main problems are two. One is, since the production of white blood cells increase abnormally high, the multiplication occurs very fast. Make sense? Multiplication occurs very fast. And many white blood cells from bone marrow, many white blood cells quickly enter into the blood because production is very high. Make sense? So blood cells are being entering into the blood. And most of those white blood cells are not mature. Make sense? Not mature. So those are white blood cells, but immature white blood cells, and they cannot perform their functions. What is the function of white blood cells?